Welcome to the deep dive. Today, we're getting into something really vital for anyone in healthcare. Leadership in nursing.
Mm-hmm.
We're drawing from leadership skills, new nurse to nurse executive. It's just packed with great insights and some personal stories, too, that really show how leadership sort of grows over a nursing career.
Absolutely. And our goal for you, whether you're just starting out or maybe you're already aiming high, is to pull out those key pieces.
Right.
How these leadership skills actually get built, the really central role of mentorship, and just why these skills are so essential for success anywhere in nursing.
Okay, so let's unpack this. The source makes it clear right away. Leadership opportunities, they're kind of everywhere in nursing.
Yeah.
Hospitals, obviously, clinics, but also, education, government roles, community health.
Just across the board.
Exactly.
Yeah.
But the thing that keeps popping up, the foundation really, is mentorship.
Yeah, and what's fascinating there, I think, is this idea that mentorship isn't just, for the brand new nurse. It's critical from novice all the way to expert. And it's more than just guiding. It's about spotting potential leaders early.
Identifying them.
Yeah, identifying them. And then, actively giving them chances, motivating them to learn new things, get new skills. It really does shape whole careers.
And this is where the real stories make it so much clearer, like Dr. Player's journey.
Mm-hmm.
Her career wasn't exactly a straight line, more twists and turns. And a big turning point came from something that sounds simple, but finding out about a salary difference.
Right, the inequity. And she realized she was a weaker negotiator, which is interesting, right? Because how does something like that, a perceived injustice, become a catalyst?
Exactly.
For her, it wasn't about being mad at her colleague. It was more like, a moment of self-reflection on her own skills in advocating for herself.
Right. It sparked a big shift.
A huge shift from hospital nursing right into academia. And if you think bigger picture, it just shows how those uncomfortable moments, if you reframe them, they can push you into totally new places you didn't expect. She even took that larger leap into business areas.
While still connecting it back to nursing.
Always building bridges back. Yeah, it was about using that challenge to really define her own value.
Okay, and then you have Dr. Burns. Her story's different. Her inspiration for leadership started even before she was an RN.
Watching a head nurse in the military.
Exactly. And her whole career path was then kind of guided by specific pushes from different mentors along the way.
Yeah, and what really stands out there is that consistent theme, observation, then inspiration, and how targeted guidance can completely change a career's direction. From that first charge nurse who straight up told her you should pursue leadership, to a faculty member who just sort of planted the seed about grad school.
Subtle, yeah.
Very. And then even a military leader suggesting a whole new specialty like nurse anesthesia, high autonomy, critical care skills needed.
A big jump.
A very big jump. Her career really shows mentors seeing potential and steering her in ways she might not have gone herself. Towards anesthesia, then later academia too. It wasn't just one thing. It was these thoughtful nudges.
So putting this all together, what's the takeaway for our listeners? Whether they're new nurses or aiming for the C-suite, the source kind of boils it down to common themes, a clear skill set.
Right. If we connect it back, both Dr. Player and Dr. Burns really embody that lifelong learning piece,
Definitely.
Problem solving, being agents of change.
Right.
And the source pulls together this vital leadership skill set. It's not just about being clinically good.
No, it's more than that.
Much more. Strong communication, being organized, knowing how to prioritize, motivating people, inspiring them, and fundamentally having a sense of service.
And emotional intelligence comes up strongly, too.
Oh, absolutely critical. That EQ piece, understanding yourself and others, which, breaks down into self-awareness, knowing your strengths, your weaknesses, self-regulation, managing yourself under pressure, motivation, that internal drive, empathy, really connecting, and then the social skills to build those effective teams.
So this deep dive, it really drives home that leadership potential isn't just for managers. It's there in every single nursing role.
Exactly.
It's about being willing to take some risks, sticking with things, perseverance, and just constantly learning.
Yeah.
And often having that mentor there to guide you.
Which really brings up the question for you, listening right now, how can you actively go out and use mentorship?
Yeah.
Find those moments for growth. Maybe even turn your own challenges into strengths, just like Dr. Player and Dr. Burns did in their own really amazing careers.
Yeah.